Greetings, fellow humans. Katrina here. Quick disclaimer, I'm a professional, not your professional. Nothing I'm about to say should be taken as medical, legal, or otherwise advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So today I thought I'd talk about what I don't know about prolonged grief disorder. If you haven't heard of it, that's okay. It is a relatively new diagnosis that came out in the DSM-5 text revision that I believe just came out in 2022. So if you haven't heard of it, that makes a lot of sense. Let's go ahead and jump right in. Grief, right? It's a natural response to the loss of a loved one. For most people, the symptoms of grief begin to decrease over time. However, for a small group of people, the feeling of intense grief persists, and the symptoms are severe enough to cause problems and stop them from continuing with their lives. Prolonged grief disorder is characterized by this intense and persistent grief that causes problems and interferes with daily life. Grief is a natural response, like I said, and the symptoms and diagnoses of that are a lot of different things. So an individual with prolonged grief disorder may experience intense longing for the person who has died or preoccupation with thoughts of that person. In children and adolescents, the preoccupation may focus on the circumstances around the death. Additionally, the individual may experience significant distress or problems when they're trying to perform their daily activities at home, work, or other important areas of their life. So the persistent grief is disabling and effects of everyday functioning in a way that typical grieving does not. So that's the distinction there. So for a diagnosis of prolonged grief disorder, the loss of a loved one had to have occurred at least a year ago for adults, at least 6 months ago for children and adolescents. In addition, the grieving individual must have experienced at least 3 of the symptoms below nearly every day for at least the past month to the diagnosis, the month prior to the diagnosis, I mean. So according to the American Psychological Association, I forgot to mention that I'm getting all this information from psychiatry.org. .org is better than .com in my opinion because they're not trying to sell you something. They're more of an organization that's disseminating information. So symptoms of this grief disorder include identity disruption, such as feeling as though part of oneself has died, a marked sense of disbelief about the death. Third, avoidance of reminders that the person is dead. Fourth, intense emotional pain. This can show up as anger, bitterness, or sorrow related to the death. Next is difficulty with reintegration, such as problems engaging with friends, pursuing interests, planning for the future. An emotional numbness. So that's an absence or even a marked reduction of emotional experience. And then second to last is feeling that life is meaningless. Lastly, intense loneliness. So that's feeling alone or detached from others. So in addition, the person's bereavement lasts longer than might be expected based on social, cultural, or religious norms. An estimated 7 to 10% of bereaved adults will experience the persistent symptoms of prolonged grief disorder. Among children and adolescents who have lost a loved one, approximately 5 to 10% will experience depression, post-traumatic stress disorder, and/or prolonged grief disorder following the bereavement. Now, some individuals may be at greater risk of developing prolonged grief disorder, including older adults and people with a history of depression or bipolar disorder. Caregivers, especially if they were caring for a partner or had experienced depression before the loss, are also at greater risk. So the risk for prolonged grief disorder is also greater when the death of the loved one happens very suddenly or under traumatic circumstances. So prolonged grief disorder often occurs with other mental disorders such as post-traumatic stress, anxiety, or depression. Sleep problems are also pretty common, and like 80% of people with prolonged grief disorder experience long-term poor sleep. That's unfortunate. The inclusion of the diagnostic criteria for prolonged grief disorder in the DSM-5 TR that I mentioned, it allows clinicians to use common to use a common standard to differentiate between normal grief and this persistent, enduring, and disabling grief. A big difference there too is insurance. So insurance will pay for certain diagnoses and not other diagnoses. And I don't really know if prolonged grief disorder is on the list of reimbursable ones, but it probably is, being that it's brand new and becoming a legitimate diagnosis that they say, okay, you can get help for this now. So treatment, speaking of help, for most people, grief-related symptoms following the death of a loved one decrease over time and do not actually impact their everyday functioning. So although feelings and symptoms of grief may arise sometimes and increase at different points in times, they do not usually require mental health treatment. However, for people who develop the more intense ongoing symptoms of prolonged grief disorder, evidence-based treatments are available. So treatments using elements of cognitive behavioral therapy have been found effective in reducing symptoms. That is the modality that I use in my practice the majority of the time, that cognitive behavioral, where the thoughts, feelings, and actions are all interconnected. Take a look at your thoughts and you might change how you feel. So one type of treatment, complicated grief treatment, incorporates components of CBT and other approaches. There's lots of different approaches of therapy to help adapt to the loss. It focuses both on accepting the reality of the loss and restoration, working towards goals and a sense of satisfaction in a world without the loved one. CBT can also be helpful in addressing symptoms that occur along with prolonged grief disorder, such as sleep problems. Now, research has shown that CBT for insomnia is effective in improving sleep. Research also suggests that CBT can be effective with children and adolescents experiencing symptoms of prolonged grief. So bereavement support groups can also provide a useful source of social connection and support. It can be a good resource. They can help people feel less alone, thus help avoid the isolation that could increase the risk for prolonged grief disorder. There are currently no medications to treat specific symptoms of grief. So despite the existence of effective treatments, people experiencing ongoing intense grief may not seek help. One study found that among caregivers with prolonged grief disorder, the majority did not access mental health services. That's unfortunate. So if you need help, call your local resources to find out what's available. In the state of Oklahoma, the resource number is 211. And if you have a mental health crisis, the number is 988, and that is nationwide in the United States. So if you enjoyed today's episode and you want to support the show, click the button on the website. And remember, I appreciate each and every one of you simply for existing.